Well, we're going to be going to Dr. Forcielli's talk next on college and emerging adulthood. So, what was the big grant that you all just received? Do you want to talk a little bit about that? Give a second about that.
Sure. Yeah. So really exciting news for our program. We were just awarded a DMH grant within the last few months that I think will really help us expand the services that we offer. Part of which has been this a venture to bring on peer specialists, so to bring on individuals who have had lived experience with illness to work directly with the patients that we're seeing and kind of talk through from a peer perspective what their experience with treaters has been and how engaging with the system has been for them. And that has really been a powerful intervention for us.
That's great. And of course, what everybody really wants to know is Gronk going to play Thursday? That's all right. I know you're not allowed to say that. What's
I have a question. So you hit schizophrenia because that's your specialty and that's your focus for your team, correct? The other two serious mental illnesses, general anxiety and bipolar. Do you want to highlight real quickly how it seems like, and maybe I'm wrong, that schizophrenia touches both of those? My son was diagnosis was bipolar schizoaffective. And the psychiatrist said it was all in the brain, but I'm not clear, and I'm not a psychiatrist, how schizophrenia touches both the general anxiety and the bipolar, because it seems a relationship there, but I'm lost.
How about just a brief answer? And then we'll...
Sure. Yeah. So one of the difficulties, especially in the first episode of psychosis, is to try to differentiate what it is that's driving the psychosis. And schizophrenia, pure schizophrenia, sort of happens even when mood symptoms are in control, whereas bipolar disorder with psychotic features, the psychosis symptoms really flare when the mood symptoms are active. Oh, sorry.
Yeah.
I was just saying that the differentiation between sort of schizophrenia and mood disorders with psychotic symptoms can be difficult, especially in that first episode. But over time, we try to make a correlation between how the mood symptoms shift and how do the psychotic symptoms follow along with that, or do they seem kind of independent and stable with that?
So we're going to move forward, and we'll have some time at the end for further questions. It's a great honor to have Dr. Gina Forcelli come from our Learning and Assessment program. And she's also co-director of our postdoc program there, so it's very busy. Talking about a very interesting point, which is sort of college, when to go next, and what's right and what's not right, something that a lot of people are here for. And I think this is the first time we've had you at Parent Education, so this is our first time, and it's always it's always a lot of fun to see our junior faculty really moving forward, taking on more responsibilities and giving their first talks to parent groups. So thank you for coming tonight.
Happy to be here. So is this the clicker? It's my first time. Is this the clicker I
That's
use?
the clicker, and then that goes backwards. And
I'm a millennial that doesn't use technology, so.
so I'll take you backward, and that's a laser.
I don't want to use the laser pointer. All right. Thank you for having me. And so for the people here that might not know what the Learning and Emotional Assessment program is, we do neuropsychological evaluations for kids and young adults now. I think there's more and more in need of that, that are having challenges that are either co-occurring mental health and learning concerns to kind of get them into the right educational environment a lot of times. I have no disclosures, so we'll kind of just get into it. And I think just a broader theme that I wanted to bring attention to, and I'm glad everyone else did, is that we're talking about a population that's continuing to develop, and we're getting more and more research that they're still kind of not finished yet, right? I think Amy Ewell talked about having a gas pedal without the brake. And there's a great book about the teenage brain by Jensen and Nutt. It came out like a year and a half ago that says kind of the same idea that with this hormone surge that teenagers have, there is a lot of development in the brain without that frontal lobe to tell them kind of when to use those different connections. So you have a brand new Ferrari without a road test yet. And so it's through these behavioral experiences and structure through families that they're going to learn that and be able to use their frontal lobes more. But in these beginning stages, they really don't have a good ability to control that rev of that engine, that 0 to 60 yet. And a lot of it has to do with more emotionally laden and stressful situations. So most kids by age 15 or 16, if you give them a scenario, they can tell you what the, in like a cool, calm, cool and collected scenario, they can tell you what the right response is and what the right decision is. When you add stress, peer influence, or any type of emotionally laden material, that goes out the window because they really can't modulate and regulate those skills. So just trying to think about that these are the kids we're now having them try and decide what they want to do with the rest of their lives, think more goal oriented into the future. That can be really hard for these kids, particularly the kids that we tend to work with learning difficulties and ADHD. I'm glad that Laura already talked about this, but that the idea of this emerging adulthood, that they are still developing well into their 20s. And she kind of went through the stages, so I will skip this, but just that they're trying to find their own identity, but there's lots of instability in this stage too. There's lots of unknown. There is hope, which is a nice thing to hold on to for for teens and young adults, that there is opportunity out there after high school that might be able to fit their needs better. Because I see a lot of kids hit the wall in high school and not know where to come next, but particularly when they're more involved. So I tell families when I see them, you need to start thinking early about what might be those next steps are. You don't have to decide what college you go to or what your major is, but thinking about the skills that you might need to either go to college or do something in a post-secondary setting like a job, right? And I think you spoke to this too, Tim, just talking about getting them into opportunities where they learn job skills, where they learn how to shadow and follow directions the best way that they can. And the way to do that is to start engaging them in a variety of activities, which sometimes I think teens have too many activities going on, and evaluating their strengths and weaknesses, what drives them, what are they passionate about, seeing if there's opportunities for mentoring, shadowing. Something that I have a lot of teens that don't have any idea what they want to do, there's a handbook called the Occupational Outlook Handbook that kind of just lists every single occupation in the entire United States that you can have. Just to kind of start to field ideas and conversations with your kids about what they might want to do and kind of giving that more motivational interviewing, like goal-oriented thinking about their future, which can get them excited and more motivated to participate in their education and just kind of their overall life, right? So the big thing that I say that I think does not get talked about enough is these soft skills that you need when you do move on past high school. The biggest one for kids that I see with learning disabilities and with ADHD or autism spectrum disorders and co-occurring mental health concerns is self-advocacy. So do they know what their strengths and weaknesses are? Do they know what they need to do to help themselves and who to access to get that support? So for kids with learning disabilities, do they know when they're stuck and when they need to get someone to help them on something? Do they know what they're entitled to as well? Particularly in the college setting, do they know where the Disability Resource Office, which we'll talk about in a second. Do they know how to advocate for themselves? And also thinking about the adulting skills, which I think Laura talked about a little bit. Can they take care of themselves? So do they know how to bathe regularly, how to take their medication on a regular basis? Do they know how to get their grocery shopping done, their banking? So thinking about these things really early on in high school, I think is important because for a lot of these kids, it's harder for them to do that and to start developing these skills. And so really thinking about that when you're starting to make decisions about college, I think is really important. And also more on like the mental health side is just like self-management. Can they understand when they're kind of in distress and when they're having a negative experiences, how they can access support? Do they access it regularly? Can they manage their time and prioritize? Because there's a lot of stuff going on in a college atmosphere. Are they able to manage all that independently? Or is that type of setting maybe not setting them up for success, right? And also more just relational skills, because there is a lot more social engagement in college that is their family. I forgot who made that statement, but your peer cohort in college is your family, right? That's who you go to support when you're there. You will always be their family, but that's who they're going to go to for support in that setting. So can they navigate that effectively as well? So talking about traditional college or not for kids, research shows that globally a four-year college is going to get you the best outcomes. So there's more intellectual and academic benefits, social and psychological benefits of going to a four-year dorm-like institution, and financially, if you have a four-year degree, you tend to have more opportunities financially, right? There are other options, and those sometimes are just, in my clinical opinion, sometimes a better bet for some of our kids, because going away to a 4-year college can be really hard and kind of more distressing and more jarring than actually trying to push them to go to what's traditional and what society thinks we need to do with our young adults. So thinking about online learning opportunities, which I will talk about, gap year, thank you, Malia Obama, community college and trade schools are also other options to be thinking about. And I'll kind of touch on all of them a little bit with the time I have. I do want to take a moment to talk about the non-college route, right? A lot of times this tends to be the populations that are just lower cognitively functioning, so intellectual disabilities, or just that have really significant mental health concerns, that there are resources and agencies within the Massachusetts and Boston area that you can access to just get vocational skills and to see what might be a good fit if post-secondary, so after high school, is it just that it would be best suited to get him into a job or her into a job setting, right? Is pushing them into a college setting really not going to benefit them the most? And do they really want to go to college, or would they rather just start working? And so these are all, I just wanted to give you those in your slides. I'm not going to really speak about them all with the time we have. But those are all resources that really highlight independent living skills and vocational skills. Speaking about the intellectual children and young adults with intellectual disabilities or with really significant mental health or medical limitations, also thinking about guardianship evaluations, where that helps you be involved in their decision making. It's usually for kids that have been diagnosed with an intellectual disability, so they have to have an IQ of a certain level, but really to think early about getting that into the works, because by the time they turn 18, that you can be part of their decisions for big financial decisions, medical considerations, and usually this involves a neuropsych evaluation. And collaboration with your pediatrician. So I would start with talking to your pediatrician if that's something that is on your radar. So for kids that might want to be going to college, but you don't think they don't have enough independence or just all the skills they need, but they might be able to get there. There are things called preparatory programs that are kind of college light. They can be 1 or 2 weeks intensive programs to just get them into the frame of what a college experience looks like, going to classes every day, eating your meals with your friends. And it can then up to be a summer or full year program for some of our kids that might need more support. So a lot of times it's for kids with autism spectrum disorders, ADHD, learning disabilities, so those kind of more developmental difficulties and kind of gauging how to manage all these different things and juggle multiple things at once. There's a couple in the area that I listed. So the college internship program is out in the Berkshires. They have full year programs, particularly for kids with autism, ADHD, and learning disabilities. There's also ones that are more geared towards vocational and independent living as well. And I can speak more to that a little bit later. I did want to talk about the gap year. So that's a new trend that people are now doing. It's very popular in Europe and has been. And basically the research out there has said that it really just helps with maturity, right? They have a better focus on what they want to get out of college. They have more idea of what they might want to pursue. And so they say that it has better outcomes. The only thing that I would say, I think it can be a great year, but it needs to be a structured year. I think you're thinking of the adolescent brain, giving an 18-year-old a free range of a year of time is not a good use of their time and is not going to be helpful for you as a parent if you want to keep your hair. So really thinking thoughtfully on what this year should be, because a gap year means that you are then going to go into a college setting or into a job. So is it going to be used to learn something while you're traveling? Is it going to be for a work or an internship opportunity that you can't risk missing? Is it for specialty classes, or is it more volunteer opportunities? And there's a good article that I wanted to list for you through Attitude, which is an ADHD website that talks about what to think about when you're thinking about a gap year. But really trying to be thoughtful and structured about what that year is going to be really important, because again, leaving teenagers with more sensation-seeking, emotionally driven behavior all free range of their day is not really going to be a good setup for them to make good choices. So really thinking thoughtfully about this year, if you do go that route, is going to be important. So if 4-year college is not the route, a lot of people think about community college. And I think it can be a great option if you're just thinking, if you really think about it in a holistic way. So it can be financially more feasible. For kids that want to just get an associate's and start working a lot earlier, this can be a great option. There's more flexibility and is sometimes like college light, so the classes feel more like a high school setting. So transitioning from high school to community college can be a better fit for a lot of the kids that I end up seeing. They tend to have more supports within the classroom, and they also are connected to the local community. So for kids with more mental health concerns, where they might need to still go to therapy every week, they need to meet with their psychiatrist, this can be a good option while you're trying to figure out how to launch them in the appropriate way. But you also need to consider, if the goal is to then go into a four-year college, do the credits transfer. What is the actual quality of what you're paying for? So even though it's cheaper, are the kids actually learning, right? Is there actually quality to what the classes are teaching them? And then they are missing out on a college experience, right? So I've had a couple of teenagers who have stayed for community college, but all their friends left for four-year college. And that transition can be really hard. And so just being prepared that that might be something that they have to go through to manage that, and finding social networks for them within their community that might not be their friends that are going to college is going to be really important for those kiddos or young adults. So thinking about those, I think, is really helpful. So now on the route of a four-year, very expensive college. So I think, especially for the populations of what I've been hearing in the other talks, location is going to be really important. If there is a kid that, a teenager or young adult that needs more support, so therapeutic support, psychiatry appointments, having them shipped to California might not be the best fit for them, especially if there's like anxiety involved and they might want to come home on the weekends. That can be a very expensive college to go to in like the middle of California. So really being mindful on where geography might limit your ability to provide the support that your child needs. The size of the school is really important. So a large university is usually very overwhelming, and the class sizes for kids with like learning disabilities and ADHD, that can be not the greatest setting for them. Thinking about financial aid, but the things that I think I wanted to highlight the most on are the quality of those extra services. What does disability and mental health services look like on campus? What do they have access to? And are there any specialized programs? More and more colleges are kind of catering to more specialized groups. So I can count on two hands. There are now multiple programs for kids on the autism spectrum. They tend to be the IT, the MITs and RPI type programs, so the tech-driven programs, but they're realizing that there's a need to kind of support that kind of independent living and social aspects of college a little bit more for those kids. There's also more programming for substance use or dry dorms that have kind of substance supports in place in college to kind of help them with the demands or the triggers that college present for kids with more substance use difficulties. And then just more peer supports and extracurricular activities and social outlets are important to consider. Things for learning disabilities and ADHD that I talk all the time about, though, is kind of things that you don't really think about asking, but you need to think about. I used to be a learning specialist for kids at a university, and I came across these difficulties all the time. So first is, who's teaching your classes? Is it a professor or is it the TA? If you have a kid with a learning disability or ADHD, having a TA can be a very difficult thing because they have less understanding of the material, and then teaching it is a little bit more, it's a little more disorganized and can be really hard to follow. And so professors have a better handle on the material to go over it with a kid that might have a harder time grasping concepts on the first run around. Also, talking to other students in classes, maybe ones that have disabilities, can be important because there are some professors in colleges that do not feel like they should change their classes and the course loads for kids with learning disabilities and other disabilities. I came across this in my work a lot, where they just felt like they just need to meet the demands of the course. This isn't high school anymore. And so really having an understanding of the culture of what the college perceives a learning disability to be, and what accommodations are for, versus it's not an out, it's a way for them to actually access, which is the legal way you should be thinking about it. But not all colleges have kind of come up to speed with that kind of perception. Thinking about course load, so how many courses is a full-time status? Is it 5 classes? Is it 4 classes? The graduation rate for different disabilities. Sometimes there are some colleges that kind of purport which their graduation rate of kids who have learning disabilities or ADHD. And then the fees for those specialized services I mentioned before. So if there is a learning support center that they can go to once a week, or there is an ASD program an autism spectrum disorder program that they can go to, how much extra is it? For our kids with more mental health concerns, thinking about transportation to and from appointments, is there an on-site counseling center? And I'll talk about that a little bit more. And this last point talks about the communication. How much are you allowed to know about how your child's doing at school? Are you able to talk to staff at the Disability Resource Center and get kind of feedback on how your kid's doing? Or is it they're very kind of close shut, kind of like, I don't know where the school was, North Carolina or somewhere where it was hard to access any kind of information about how the kid was doing. I did want to make one small caveat on online learning, that there is very mixed support on if that actually is a good learning modality for kids, particularly ones with learning disabilities. There actually are some studies that show that 90% of people who sign up for these online courses fail to finish them, and it's unclear if they actually learned anything. And for our kids that learn in different ways and have a hard time focusing and taking initiative, this can be a recipe for disaster for them, right? So it's that passive learning that there are some people that are able to do that, but for our kids that need things presented in multiple ways, need more interaction and more experiential learning is the term for it, online learning can be really hard for them, because that first line about initiative, focus, and self-discipline are not that population. So really thinking about, if they have to take an online course, okay, but kind of thinking if their whole course load is all online classes, is it really a good use of your money? And is it a good use of their time, right? So most schools are going to have a regular writing center they can go to, tutors and TAs, but the ones I want to talk about the most are Disability Resource Center and the CAPS program, so the Counseling and Psychological Services. Most schools have them, and looking into each one can be really helpful. Disability Resource Centers are there to provide accommodations for children with documented disabilities. So you need to have information that says they have a clinical diagnosis of a disability. So that means you either need to get an updated neuropsych evaluation, like a LEAP, or you need to have documentation that they've been on an IEP or a 504, getting certain types of accommodations to kind of even be qualified for these types of services. But the IEP will not be followed. Disability Resource Centers in college are for ADA, that's American Disability Act, which means they will give some accommodations, but they do not provide services because you have a disability. And so there's a little bit of a difference from when you were kind of supported through the IDEA with a high school, and then jumping to a Disability Resource Center where they don't provide a lot of accommodations, and some schools don't even provide much of any. And so it can really vary between schools. So things to think about that usually disability resource offices at schools will provide are extra time, testing in a quiet location, note taker, laptop use. A lot of other schools will vary on a language waiver, like if you have dyslexia and learning a second language is hard for you, some schools will not waive the language requirement. Course load or modifications for full-time status, if you are having depression or anxiety and really can't manage an entire course load, how does a school manage that? And then housing and roommate requirements. Like I had a girl with social anxiety and I was able to write her a letter to be in a single room versus in a co-dorm situation because it was just too overwhelming for her and she couldn't sleep. Things to consider for specific diagnoses, autism spectrum disorders, really thinking about social mentorship programs. These are great programs that peers will bring kids with kind of more social anxiety or social difficulties to social settings and help them facilitate conversations or interactions with others. For ADHD, thinking about kind of that frontal lobe stuff. So class scheduling, large versus small classes. Don't give them the 8 a.m. class because they likely have problems getting up in the morning. How grading is in classes. Is it all tests or is there more incremental grades like essays, labs, and projects? And I did give you a list of apps that are helpful in this age of technology for kids with learning disabilities and ADHD. So different note-taking apps, scheduling apps, speech-to-text is a great one too, and audiobooks as well. Just to kind of consider for your kiddos that might have a learning difference and just need a little extra support to kind of help them take in the information in classes. For mental health, really looking at the CAPS program, what they provide what type of psychotherapy they provide. Do they provide psychiatric consultation? Is there any eating disorder or crisis management services? But really asking more questions about what is the lead up to getting an appointment? How many appointments can you have? Because usually it's short term. The CAPS programs are not ongoing therapy for your whole year. It's usually 2 or 3 sessions and then that's done. And so if you need someone with more continuous care, or your kid needs more ongoing therapy and psychiatric consultation more continuously, thinking of that location, geography, or what community resources you have in that college area that they can access, and if they're able to do that independently. And then kind of talking about, I don't like this title anymore, just thinking about that this is a time where they need to learn how to do this on their own, that like advocacy piece. And so being there for them and supporting them, but also letting them kind of learn a little bit through making mistakes as well. Like if they get a bad grade on a test, like not calling up the Disability Resource Center about their accommodations. So helping them grow and get independence and advocacy for them. But also the check-ins I think are really helpful. And I usually tell most of my parents to do this with their kids, where they kind of schedule a Skype session to just lay eyes on their kid like once a week, just to kind of see how things are going, maybe almost coach them into like how the rest of the week is going. You can kind of act like their frontal lobes a little bit and then check in the following week, but you're not nagging them every single day on what they need to get done, because this is their period where they want to be independent and they want to feel like they've accomplished things. And so you really need to give them growth to be able to do that. And sometimes they have to fall a couple of times before they're able to figure it out on their own. But I'm happy to talk about more. It's a lot to think about. So there are lots of other resources you can talk to when you're thinking about colleges. The biggest one I wanted to highlight that not everyone knows about are educational consultants. They are people that will talk to you about, they have a very good knowledge of what colleges are around the country, what can meet, particularly for kids who have more specialized needs. So anxiety, depression, and more of that kind of mental health concerns, or more of the learning disabilities and ADHD. They know the college atmosphere and what supports are in place across the United States. They usually can be expensive, but it's usually a good investment when you think about you're paying 60, 90, 100,000 a year anyway. You might as well invest them in the right school than kind of paying for 2 years and then having to start the process all over again. So they're a really good resource to think about, and I know some names if you want to talk to me after, to kind of use that as a tool to help you. But that's kind of it, so thank you.
Very helpful. I just have to underscore this issue that